Welcome. Today we're diving into a rare and fascinating condition known as bladder melanosis. This video will explore what it is, what causes it, how it's diagnosed, and what the potential implications are. So, stick around as we shed some light on this unusual urinary system disease. Let's delve into the possible causes. The exact etiology of bladder melanosis remains somewhat unclear, but it's believed to be linked to an abnormal proliferation of melanocytes, the cells responsible for producing melanin, within the bladder lining. Some theories suggest that chronic inflammation or irritation of the bladder may play a role in triggering this melanocytic proliferation. Genetic predispositions are also being investigated, but more research is needed to fully understand the underlying mechanisms. Essentially, we're looking at a situation where pigment-producing cells are over-represented in a place they shouldn't be. Now, let's look at the pathophysiology, or how this condition develops. Melanocytes migrate to and reside within the bladder's lamina propria, the connective tissue layer beneath the bladder's inner lining. They produce melanin which accumulates within these cells. This melanin deposition is what gives the bladder lining its characteristic dark brown or black discoloration. The extent of melanosis can vary from small, localized patches to more widespread involvement of the bladder mucosa. The increased melanin presence itself doesn't directly damage the bladder tissue, but the underlying triggers and the potential for misdiagnosis can have consequences. Because bladder melanosis is rare, precise epidemiological data is limited. It appears to affect individuals across a broad age range, although reports are more common in adults. There is no known significant difference in prevalence between men and women. Its rarity means that large-scale population studies haven't been conducted, which makes it challenging to determine definitive risk factors or demographic trends. In short, we don't have a clear picture of who is most likely to develop this condition. Often, bladder melanosis is asymptomatic, meaning individuals may not experience any noticeable symptoms. It's frequently discovered incidentally during cystoscopy, a procedure where a camera is inserted into the bladder to examine its lining, which is performed for other reasons, such as investigating hematuria or blood in the urine. In some cases, patients might experience urinary frequency, urgency, or pelvic pain, but it is unclear whether these are directly attributable to the melanosis itself or to other underlying conditions that prompted the initial cystoscopy. So, be aware the presence of symptoms is not the standard presentation. Diagnosis typically involves a combination of cystoscopy and biopsy. The cystoscopy allows the urologist to visually inspect the bladder lining and identify the characteristic dark pigmentation. However, visual appearance alone isn't enough. A biopsy is essential to confirm the presence of melanocytes and melanin within the bladder tissue. This also helps to rule out other, more serious conditions, such as bladder cancer, particularly melanoma, which can sometimes mimic the appearance of melanosis. Histopathological examination of the biopsy specimen is crucial for accurate diagnosis. Bladder melanosis is generally regarded as a benign condition, meaning it's not cancerous and doesn't typically spread. However, because it is rare and can mimic other, more concerning conditions, it's important to differentiate it from conditions that harbor malignant potential such as primary or metastatic melanoma. Therefore, any observed bladder melanosis should be followed closely by a qualified healthcare provider to monitor for any changes over time. Since bladder melanosis is usually asymptomatic and benign, specific treatment is often not required. The focus is primarily on monitoring the condition through periodic cystoscopies to ensure that it doesn't progress or transform into something more concerning. If symptoms are present, management is directed at addressing those specific symptoms rather than the melanosis itself. For example, medications might be prescribed to manage urinary frequency or pain. If there is concern about potential malignancy, more aggressive measures, such as partial cystectomy, could be considered, but these are rare. Currently, there are no known specific preventive measures for bladder melanosis, largely because the exact cause remains unknown. Maintaining good overall urinary health through adequate hydration, avoiding bladder irritants like excessive caffeine or alcohol, and promptly addressing any urinary tract infections might be beneficial, but there's no direct evidence to suggest they prevent the development of melanosis. The focus remains on early detection and monitoring. The prognosis for bladder melanosis is generally excellent. It's considered a benign condition that rarely poses a significant threat to health. However, long-term follow-up is crucial to monitor for any changes and to rule out the possibility of malignant transformation. Though this is exceedingly rare, recent research is focused on better understanding the underlying mechanisms of melanocyte proliferation in the bladder and on developing more accurate diagnostic tools to differentiate melanosis from other pigmented bladder lesions. Further research is needed to determine any link to other underlying conditions.